we're talking health insurance for all. The Lagos State government's call, okay? And who's better suited to take us through this discourse other than Dr. Emmanuella Zamba? She is General Manager, Lagos State Health Management Agency, LASHMA. Nice to have you in the building, madam. Good morning.
Good morning.
And you're welcome back to Traffic Radio.
Thank you.
Nice to have you back, madam. All right, Dr. Zamba, before we jumpstart this conversation, let me first start by congratulating you on your appointment as the substantive general manager for LASHMA. So congrats, ma.
Thank you so much.
Right. And still dwelling on that, let's talk about your agency. How has this been faring for LASHMA since you assumed the helm of affairs of that agency?
Well, we've been making quite significant strides in spite of the COVID-19, which we will all agree has slowed down things on a general level. We have tried to leverage on technology to even access Lagos residents as well as the enrollees under the scheme with the EcoTelemed that we launched in May with the approval of Mr. Governor. And that has really helped to reach out to people so that they have access to care without necessarily walking into a facility, thereby exposing themselves unduly. We've also been meeting with a lot of stakeholders to see how we can access the informal sector, which is where the majority of us in Lagos State belong to. If we're going to make significant progress in terms of covering people with health insurance, we need to be able to penetrate the informal sector. So that is something that we are working on very actively as an agency.
Okay, then. So let's talk about the Lagos State Health Insurance Scheme. Has it kicked off fully in terms of implementation?
Yes, indeed. As you recall, I was here 2 years ago when we were launching in December 2018. However, we started providing access to care around July last year to members of the public. So yes, we are working. Our numbers are increasing. And
for those who are wondering about the real essence of this scheme, I just wanted to take some little time, madam, to explain the idea behind this initiative.
Okay, so we know that health for us in Lagos, people have this religious or cultural attitude towards it. It's not my portion. People don't want to think about it until it actually happens. And usually by the time it happens, because we know that, economy is not fantastic now, a lot of people will either continue to stay at home until it gets really bad. They are almost, at death's door. Then people start running around, borrowing money from different people to pay. And eventually, most times, if a family has, a moderate or severe illness, it actually affects them economically moving forward. And so this scheme really is to help us as residents in Lagos State to be able to put a little away for our health, so that the day we actually really do need it, well, we will, either us or our family members, there's no running away from it. It's a fact of life. The day that we actually need to access health, you can have 0 naira in your pocket on that day. You walk into the facility and it is your right to access the care. So that's really, how can we make health accessible to everybody, regardless of how much is in your pocket? You'll have the same standard of care, and at least we prevent a lot of preventable deaths.
Which is very, very good. All right, so how does it work? Let's begin to break this down for our listeners this morning, because some were talking about health insurance, some have been wondering, okay, this is what it's supposed to be. So from the LASHMA perspective, how does it work?
Yes, so you are a resident in Lagos. You are able to provide some level of evidence that you live and work in Lagos State. It could be your LASRA ID, it could be your utility bill, your rent, whatever shows us that, gives us sufficient evidence that you are a resident in Lagos State, because this scheme is for Lagosians. Once you're able to do that, you can either walk into one of the general hospitals or some of our private healthcare centers, or even go online. We have a website, lashma.com. www.lashma.lagostate.gov.ng. You go online. We have an IT platform that we use. You can register, put in all your details. The cost is 8,500 per individual per year, and 40,000 per family of 6 per year. When I say 6, I mean mother, father, and 4 children under 18.
Okay, under 18. That 18. Must be specified.
Yes, it is.
Okay, so 8,500 for a year. What does that cover, really? Let's begin to look at that.
Okay, so actually, a lot of thought went into arriving at this cost and the package, and we feel that it is the most competitive in the market. With that amount, that small amount of 8,500, you not only access care for your children, whether it is malaria, whether it's measles, whether it's diarrhea and all that. You also access maternal care in terms of antenatal care, postnatal care, normal delivery. If your wife requires a cesarean section, she gets it free of charge. We also have care for chronic diseases like hypertension, diabetes, asthma. You can have x-rays done under this plan if you need it. If you need some lab tests, these are also done under the scheme. We also have some surgeries like appendectomy.
I'm just about to come there. So
which can be
does it
very
cover
life-saving.
surgeries as well?
Yes, it covers appendectomies, it covers inguinal herniorrhaphies, and small moderate
Some minor surgeries.
Yes.
Okay. All right, so that sounds pretty interesting. With 8,500, it sounds pretty competitive, like you said. But how different is this scheme to the National Health Insurance Scheme, which is operated by the federal government?
Yes, well, the National Health Insurance Scheme, they do have a much more robust package than what we have, and of course that means it costs more. It's not our plan is more focused on the family as opposed to individuals.
Okay.
Yes. We have also introduced a modality whereby you can actually pay instrumentally if you do not have, because we know many people might not be able to bring out the 40,000, even though we say it's very competitive and affordable. Some people may not be able to bring out that amount at once. So we have an arrangement whereby you can pay small, as they say, or sans dear, and then eventually you are able to access care. So that's one of the innovations we are.
All right, then. So let's begin to look at this now. It's been on for like a year and... let me say, in terms of implementation now, let's say 14 to 15 months, as the case may be. So, how would you rate it? So far, so good. Are Lagosians keen into this scheme right now?
Yes. Wherever we go, we get good reviews in terms of, this is something that's affordable. This is something that, would bring a lot of benefits. I would say that we are ramping up awareness for the scheme. So, in the next few weeks, there will be a lot of things hitting the airwaves and moving around the communities to be sure that we get this into the consciousness and awareness of all Lagos residents to come and tap into this very, very good and highly beneficial initiative.
Right. Now, I know that when this kind of initiative comes up, a lot of times the focus, initially is always on the government workers, the civil servants and all of that. The private sector, are they plugged into this as well?
Yes, we do have private people from within the private sector keen into the scheme, most definitely. We even have, it's not just public facilities that provide care, but also private facilities. In fact, most of the facilities currently under the scheme are majorly from the private sector. So that is also an incentive to draw in more people and de-emphasize the fact that, it is a public project, so to speak.
Okay, then. So now LASHMA is the regulator. Is that correct?
We are the regulator.
So let's talk about those intermediaries. Oftentimes we talk about the HMOs. Is that correct?
Yes.
So how many HMOs are plugged into the Lagos State Health Insurance Scheme right now?
Currently, we have about 13 of them and counting that are working with us in various capacities. We are leveraging on their experience in the health insurance space to be able to widen our reach and be more effective and efficient in how we provide services to Lagos residents.
Right, 13 of them, and these are located, are they evenly spread across the state? Because when you talk about your operations now and people getting access to this health, somebody who's in Badagry, someone who's in Ekpe, can they access?
Yes, we have them evenly spread across the state.
They're evenly spread?
Yes.
Okay, that sounds pretty interesting. So let's begin to break this down now, and I wanted to explain this much more on how it works, the technicalities that are involved, before we begin to take calls from our people. So I worked with company A or B, and I want to get myself plugged into the Lagos State Health Insurance Scheme. How do I do that?
So, as I said earlier, you can either go onto our website, you can make a call. We have numbers that people can call into, or you can walk into our office. and get yourself registered. We also have registration points spread across Lagos where people can access and get their enrollment done to join us on the scheme.
So, is the health scheme, this one from Lagos State Government, is it compulsory?
We have a law backing it saying that it is compulsory for all Lagos residents to have insurance coverage. That is what the law says.
That's what the law says.
Yes.
All right. So let me bring this to you because a lot of people begin to ask this question now. I work with a social organization, and already I'm covered, or perhaps I have a kind of health insurance cover which I am running at the moment. So what do I do? Do I have to leave that one to plug into the Lagos State Government, or how do I run this? Since you said it's compulsory.
Yes, so I know that there has been a bit of, what word would I use? A little bit of confusion with regards to interpreting that aspect of the law. And really what the law says is you must have insurance cover. It is not mandating per se. If you do not have any insurance cover, come and get the LSHS, because the LSHS is affordable and it is accessible, and you will get your value for money. But if you are, for instance, a lot of the corporate Lagos already have plans, and we're not saying jettison that for coming on to the LSHS. What we are regulating is to ensure that everybody is covered with health insurance so that we can improve our health indices.
So it's not mandatory that you have to leave the one that they are...
No, we're not preaching that.
Oh, okay. All right.
Just make sure you're covered.
Okay, that sounds...
And we have evidence to show that you are covered.
That sounds pretty interesting. But for government workers, they have to be plugged into this?
Government workers are
mandated.
The Lagos State Health Scheme.
They are mandated, right?
Yes.
Okay. I wanted you to really bring that down for us. All right, so you talked about the premium, and someone will be wondering, really, 8,500, it sounds pretty good. 40,000, it sounds good. But if I have more than 4 children, how can I plug into this?
Yes, so if you have more than 4 children under 18, the additional children go 6,000 each. If the child is above 18, it is 8,500 because they're, more or less an adult.
All right. Okay, so that simply means if I have 6 children, so we're talking about 52,000.
Correct.
Okay then. All right then. Lagos Traffic Radio 96.1 FM. Health insurance for all. The Lagos State Government's call is our focus this morning, and taking us to the classroom, or perhaps breaking it down for us, is the General Manager for the Lagos State Health Management Agency, talking about Dr. Emmanuella Zamba. Okay, so it's time for us to expand the conversation beyond the studios and have your input as well. Let's see if you do understand the nitty-gritties of this, but if you do not, she's here to break it down and make you understand, and also see the reasons why you need to plug into this. But before I begin to take your calls, madam, just talk to our listeners the benefit of signing on to the Lagos State Health Insurance Management, the health insurance scheme. What are the benefits?
What are the benefits of joining this scheme? They are immeasurable. I do not think you can put a value on your health, so to speak. We have made sure that what we are offering is very affordable. We have also introduced means to make it something that people can actually pay at their convenience. And this is something that if you key into, virtually all your the normal health needs or health requirements that people usually go to the hospital for are covered by this scheme. We also give you the opportunity to change providers if you feel the need to. We are very responsive. We have a call center that is 24 hours. You call in, you have issues, you have inquiries, we are there to listen to you. And overall, I believe that you can't really get it any better.
All right, then. Okay, let's begin to hear from you then. 0809-912-0777. That's the numbers to connect with us on the program this morning. Hello, my first caller on the line. Good morning.
Hello, good morning.
Good morning. What's your name?
My name is Taiwo.
Okay, Taiwo, where are you calling from?
I'm presently calling from Anthony now.
Okay, then let's hear you, Taiwo.
Yeah. I just want to ask one or two questions concerning the Lagos State Health Scheme. Number one is that the issue of pre-existing medical conditions, are they covered on the scheme, like hypertension, the Betty's and others.
Okay.
Then, somebody told me that they had an experience under this scheme sometimes maybe like 2 weeks ago. They went to the hospital and the hospital denied the person having access to care for hypertension under the scheme. And apparently the person died on the for that particular ailment.
Okay.
I just want to be clarified if hypertension and diabetes are covered on the scheme.
All right. So it's related to your very first question then.
Okay. Let's just round it off like that.
Okay then. All right. Thank you very much, Taiwo. My guest will respond to you. All right. We're going to put the calls together, and then we can allow Dr. Zamba to give a response to all those questions. 0809-912-0777. You can also send your comments via our social media platform as well. Hello there. Good morning.
Good morning.
Good morning.
My name is Ademola. I'm calling from Ikeja.
All right, Ademola, what's your question or what's your concern?
I just want to ask, in the process of registering, are we going to pick the hospital of our choice and the medical center, or we can go anywhere to get treatment?
Very good question. Any hospital of your choice or a medical center? All right, thank you. I'm sure she'll respond.
Okay.
All right, thank you. All right, let me see if I can take this update that's coming in right now. Lagos Traffic Radio, 96.1 FM. Hello? Hello? Yeah, good morning.
Good morning. I'm Fadikwe from myself.
Okay then, Fadikwe, go ahead.
Yeah, and I want to the that break down there.
Yeah.
To move it out of the road.
Now, let me get that. You said Atowode lady, what has broken down there?
So what the lady in what my 12.
Yes.
So from what the lady to my 12, we have a slight slow movement towards my 12. In the lady get my 12. All the vehicles have been diverted to the service station.
Okay.
A crane is going to rescue one of our breakdown at the inward Ikorodu. Is on his way from K2 coming to my 12. So we have got the diversion now, has been diverted to the service lane while we are waiting for the crane. But because it cannot pass through the corridor.
Right.
And the service lane, except it don't carry through.
Okay, so
anybody that traffic just there with us for the next 5 minutes.
now it's a truck, right, that has broken down at Atowode lady?
Yes, that one will be taken care of within a few minutes now.
All right then.
So the is out of the road, I will call you.
I appreciate that. Thank you very much, Fadikwe.
Yeah, I will call you the train is over now.
All right.
So I won't put the gas carry train again.
Okay then. Thank you. All right. So that's what's happening within the Ikorodu corridor. With the lady, an impediment there cited also by mile 12. Counterflow on at that particular location. All right. Let's hear from you. 0809-912-0777. We're talking health insurance this morning. You want to ask my guest any question? Feel free. Good morning.
Hello, morning.
Good morning.
Yeah, Tosin is speaking from Sabo Yaba.
All right, Tosin, go ahead.
Yeah. And my own observation is that thing is so costly.
It's so what?
The HMO is so costly.
It's too costly.
Yes, not everyone can avoid 3 square meals.
Okay.
And if Lagos State is subsidizing for us, the indigent, I don't know why it's going to be so expensive like that. Because I can remember in 10 years ago, I did one HMO. Victor, don't let me lie you. I did that HMO, 2,000 naira. And my wife put to bed on that thing. I give birth to my 2 children on 2,000 naira per year.
Which year was that?
That is, my first son was 10 years now. My second daughter is 7 years. And I use a good hospital. Zenith Bank is using that hospital. Oceanic Bank was using that hospital. I feel so impressed.
Okay, for 2,000. Now, let me find out. This 2,000, was it per annum or per per month?
It's a year.
A year.
They will put me I don't want to make name of that HMO. They will give me a card. I see have some of the pile-up cards they give. I do renew it every year.
So let me ask you, where did you work for at that time? Where were you working?
I was a trader. I did the HMO at Oduweyemushi. Even it is my wife's mother that introduced me. Say, oh, tell your husband to come and get this. You have access to hospital and
okay.
And I just give my wife that money.
All right. So you think the 8,000 naira is too costly, right?
My Victor, the country is not thin. They are doing it those who are rich.
Okay.
Not we that we are poor.
All right then. But you are not poor. I hope you know.
Victor, it's just a God grace.
All right. All right, Tosin. Thank you. All right. Thank you so much. All right. So Tosin he has a feeling that the premium paid is too high. All right. I'll take one more before I get back to Dr. Zamba, and then she can respond to all these calls at the same time. Good morning.
Yeah, good morning, Victor.
Good morning.
Comrade Daniel.
Comrade Daniel, nice to hear from you.
Thank you very much, Victor.
Yeah. Go ahead.
Morning, madam. Yeah. Yes, I think the health insurance scheme being adopted by the government is a good thing, and it's a way forward in health issues or better individuals in Lagos. My question to madam is that, is there going to be a policy document at the end of the day stating the nitty-gritties of the scheme? Because at times we discover that there's a limit. For instance, somebody's wife has to go through cesarean sections. You know, most of these private hospitals, they charge a lot. Some 250, some 500, that depends thereabout. So what is the limit at the end of the day? If there's a limit, that is to say the client or the patient or the insured have to pay the balance. So how can that be explained?
All right.
Secondly, if I have less than maybe family of 5, not up to 6, as you said, for the 40,000 cover.
All right.
Would I have discount? Would that be a discount for me because I don't have to? I will not have 6.
Okay, so if you have a family of 5 or 4,
yes, or 4, yeah.
So would that be a discount?
Yes.
Okay, all right. Thank you so much, Comrade Daniel. Yes. All right, so Dr. Zamba, let's get back to you. The ball is in your court right now. Let's see. And where are we taking it from? From the top or from the rear?
From the top.
From the top. Okay, then.
Thank you all very much for the questions. I'll start with Mr. Taiwo from Anthony. He asked if there are existing medical conditions that are covered by the scheme. While I was talking, I did mention the fact that, yes, indeed, some chronic diseases like hypertension, diabetes, and asthma are covered by the scheme.
They're covered?
We also have for us to do screening and this thing for HIV and tuberculosis as well.
All right.
If you have a pre-existing condition, it does not preclude you from joining the scheme.
Okay.
Whether the woman is currently pregnant, some schemes will say you shouldn't come on the scheme when you are pregnant. But we are even looking for these pregnant women because we really want to reduce our maternal mortality.
All right.
So we don't have any preclusions as to who can join the scheme, whether it's your age or whether you have any existing diseases. Those things are not a barrier to joining the scheme. And definitely, he talked about a case where somebody was denied. It is possible that that person had complicated hypertension, maybe had a CVA or something. So that's not... those are like complicated things that are not under a basic medical healthcare package.
When you say complicated, what are we talking about here?
So the person might have had a cerebrovascular accident, like a stroke or something, with regards to, hypertension leads to various complications.
Yeah, okay.
So what is covered really under the scheme is you are on your medication, you come in for regular checkups, but the complications that evolve from that's no longer a basic medical care. That is now secondary care or tertiary care, as the case may be.
All right.
So there are subtle differences to that.
Okay. Let's move to the next person. Ademola from Ikeja.
Yes, Ademola from Ikeja. So he did ask about hospital choice. Currently, we have about 250 health facilities under this scheme. About 65% of those are private. We do have an existing list. Wherever you go to register, you will be given the list. You can check on our website. The list is also there. And the choice is yours, really. really to make, as I mentioned. So you can choose a government facility, a private facility, preferably maybe one near where you live or where you work, depends on you really.
Right.
The choice is all yours.
Okay. Tosi says it's too costly.
Yes, Tosi said it is too costly. We do understand that times are hard, and harder even still yet with COVID-19 that has hit us this year. And really, government is very aware that there will be people within our society that cannot really pay.
All right, just 1 second. Let me see if I can take this update that's coming in right now. LASHMA monitor, hello there. Good morning.
Yeah, good morning once again.
Fadikwe.
So the crane has passed. We have opened the counterflow again.
Good.
So there's a better movement now from my 12 inward case.
Okay then. All right.
Yeah.
Thank you. All right. So counterflow is that's been suspended. The main carriageway has been opened, and so you can still make access through that corridor from mile 12 inwards K2 proceeding down to Ojota. It's much better right now. So yes, madam, you were trying to just make us realize some of the things.
Yes, we know that times are hard and harder still because of COVID this year, and government is fully aware of this. So we do have a program subsumed within this Lagos State Health Scheme where we identify people that cannot pay for themselves in a very scientific manner. So it's not just everybody that can walk up and say, I am poor, ma, I'm poor, sir.
Okay.
We have a scientific way of identifying you as poor. We verify that, and there is a fund that is available for people that cannot pay for themselves.
So to see if his face is poor, you can access that, right?
Indeed.
All right. Comrade Daniel, a policy document that states all of this, or how do we know the limits?
Yeah. So we do have what they call terms and conditions. As you want to conduct your registration and enrollment, there will be something that comes of, we call it the T's and C's. It will tell you what the terms and conditions are. What I can say that, for instance, cesarean section is free. It is free. There is no limit. I know that some plans out there, they limit this, even though they say you come and pay this amount per year, but once you have raked up a bill of up to a certain amount, you can no longer access that plan for that year. That is not what the Lagos State Health Scheme is all about.
Right.
If you need care, you get care whenever.
Okay, then let's get more feeds from you out there. 0809-912-0777. You can also express that on our social media platform as well. Lagos Traffic Radio 96.1 FM. That's our Facebook and Twitter handle at Lagos Traffic 961. Hello, good morning.
Yeah, my name is Yemi.
Your name is?
Yemi.
Okay, Yemi, where are you calling from?
I'm calling from Ojoji.
All right, go ahead, Yemi.
Yeah. My question is, for the benefit of civil servants, how can they access it freely? Or is that, let the woman explain better on how civil servants can access this thing.
Civil servants?
Yes.
Okay. All right, thank you very much, Yemi. All right, so civil servants?
Yes, so the government has been very magnanimous to us as civil servants. They are actually subsidizing our own premium by 75%, and we are only supposed to pay 25% of that amount of 40,000. We have HMOs that are distributed amongst all the ministries, departments, and agencies of the public service, and they go in and register all staff. They are enrolled onto the scheme. The staff is responsible for choosing which hospital they want to attend. And once they have their policy, their Lagos State Health Scheme policy identification number, they just walk into the facility and access care. It is their right.
Okay, then. All right. I hope that satisfies your curiosity. Yemi, let's take some more. 0809-912-0777. Hello, good morning.
Good morning.
All right, please turn down the volume of that radio.
Good morning, sir.
Yeah, good morning.
Please, what I want to ask the madam. Yeah, madam, good morning.
Good morning, Ogami.
What's your name, sir?
Mr. Sunday from Anthony.
Okay, Mr. Sunday, go ahead.
Yeah. So, please, what I want to ask is, all these things now you are saying, I don't know, it's so easy now. But when you are going for it now, it will be hard. So we may go in time before they attend you. People they know we now attend. We just come even before you yourself. They there before they come. They will now attend the threat before you. We don't come in time. How can we do all those things?
Okay, treatment from the health facilities, right?
Yes.
Okay, all right. Thank you so much. We'll respond. That's a source of concern for some people, really, because sometimes when you're plugged into schemes like this, by the time you get there, there's always the excuse that if I do not get an authorization from somewhere, no treatment. So how would you respond to that?
Well, I think there are two things in one in the question he asked. I think he was also talking about waiting period within the facility as well. The truth is we have a very stringent requirement for people, for the facilities that join the scheme. So we all know that hospitals generally are accredited by the Health Facility Monitoring and Accreditation Agency in Lagos. You have to have been accredited by that body to come to the Lagos State Health Scheme. And when you come to the Lagos State Health Scheme, there is another level of criteria that you have to fulfill to be able to come onto the scheme. One of that is to show us a clear path or process for people that walk into your facility that are on the Lagos State Health Scheme. So we do not want to know about whatever it is you have as your routine for your normal patients, that's other patients that walk in. But for those that come in that have already prepared for this service, what do you put on ground for them to be able to have speedy access to the doctors and speedy access to their care? So those are one of the things that we monitor very stringently. I did mention that we have a call center, so even if a patient walks into a facility and there is some issue, because obviously there will be, from time to time, nobody can be perfect. We expect that you call, and our turnaround time is really first class in terms of how we respond and how we access those facilities. All
right. So before the end of the program, I would allow you to give the number so that people can get that as well. But let's still listen to our listeners. Let's get more feeds from our listeners. This morning, we're talking health insurance and how best to plug into the Lagos State Health Insurance Scheme. What are your thoughts? Talk to me. Hello, good morning.
Good morning. My name is Afolabi.
Afolabi, where are you calling from?
Yeah. I'm calling from Ikorodu Road.
All right, go ahead, Afolabi.
What I want to ask is, you see, I've experienced this before. I have an insurance, some other countries, when you open a bank account, the moment you put in money there, they automatically insure you anywhere you go. Then when I come to Nigeria, go to the general hospital. I don't want to mention the name of the general hospital, but if you want, I can mention it for you. They start asking me all sorts of questions. They ask me to fill up the form. I fill up the form. Do you know I have to get angry and leave the hospital? Because for like 5 hours, nobody attends to me. I have to go to the private hospital to go and sort myself out, pay the money, get the bill, and go and give it to the bank.
And you were on this scheme, this insurance scheme?
Yes. And the bank paid me back the money.
Okay, which year was this?
That's about 5 years ago.
5 years ago. Okay, so certainly not this particular scheme, right? Not this one.
No, not this one. I'm just telling you from experience. So when we are giving money to some of these organizations, so we need to be 100% sure that what we're paying, we're going to get it back.
Okay, all right.
Because some of the time it's not working the way. It's easy to talk, but it's not easy to be done.
Right. Okay then. Thank you so much, Afolabi. That also sounds similar to what the previous caller talked about in terms of treatment from such health facilities. Let's hear from you before we begin to wrap up on the program this morning. 0809-912-0777.
My name is Tony.
All right, Tony, where are you calling from?
I'm calling from Sura presently now.
Okay, go ahead, Tony.
I had an issue with VI now, which I'm just getting updated because I do listen to traffic radio. Not quite long, I just lost my job due to this COVID pandemic.
Okay.
And I do sometimes for weekend, I do drive Uber, something. Then presently, I was just driving towards Sura.
Okay, you know what, Tony, so that we do not take so much of your time, by 1 o'clock this afternoon, just listen up. Everything that relates to what you're talking about will be on the program.
Presently, I've been delayed now. Can you just refer me maybe to for the clarification for me to be able to hear from maybe other line or other superior or other other places I can get the information so I will know that what they are charging me for is right.
Okay. All right. So I'm going to take your number right now, and by 10 o'clock, after this program, we'll communicate with you. Okay?
By what? Pardon?
By 10, we'll communicate with you after this program. Okay?
After the program?
Yes, we will.
Please, we appreciate that, please.
All right. Thank you. Thank you so much. Let's begin to take this to the next level, madam. Just a brief break. We'll be back. All right, then. So, Dr. Zamba, people are still concerned about the treatment from health facilities and the tendency that they might, perhaps, the kind of experience they've had before, they're bringing that to this particular scheme. So how is LASHMA going to ensure that your HMOs, or perhaps those that will be providing these services for you, are going to be up to scratch?
Okay, so I did mention that we have a stringent requirement process for you to even come on board the scheme. We also have a very robust monitoring mechanism that is not only done by the HMOs who we are in partnership with to administer. We also have in-house our own team as well that goes out. We have a whole department responsible for this particular responsibility. And as I said, our call center is always up to the task. We have real-time turnaround in terms of feedback of complaints from our facilities, and we don't take these complaints lightly at all. In fact, some of our facilities have been sanctioned in the course of us implementing this scheme for infractions and complaints from facilities, from our patients.
All right, let's get the call center now, if we can. Get those numbers out so that people can then reach you.
All right, so you can get us at our call center on 0901 399 1981. I'll take that again, 0901 399 1981.
Okay.
The other number is 0816 405 1031. Again, 0816 405 1031.
All right then. So for those who want to plug into this, you said your website again? They can.
It's lashma.com.
Okay.
That's www.lashma.lagostate.gov.ng.
All right. Okay then, so we have to terminate the conversation at this point, but as we depart the program, what's your message to our people this morning, madam?
I'm here appealing to us as Lagos residents to please take advantage of this wonderful initiative. It will help us to not only improve the quality of our lives, but also lengthen our lives in terms of the fact that we will be able to always access care when it is needed, and it does not have to burn us in the pocket or generally impoverish us as a family to be able to do so.
Okay, at the moment, the target is for how many millions of Lagosians to plug in?
As many millions as possible. Yes,
and at the moment, right now, how many has plugged in now? Do we have the figures?
We have about 250,000.
Okay, so we're hoping that can be ramped up before the end of the year.
Yes, that is correct.
All right, Dr. Emmanuella Zamba, it's nice having you in the building. Thank you so much for coming on the program this morning.
Thank you so much.
Okay, so we've been able to, just have this chat this morning, and it's all about health insurance for all, the Lagos State government's call, and of course the general manager for the Lagos State Health Management Agency, LASHMA, in the person of Dr. Emmanuella Zamba, has taken us through this excursion this morning, and I hope you've been able to benefit one or two things in terms of how it is being implemented. Okay, so you have those numbers. Make sure you call them, and of course you get the best in terms of service. But we have to go. Thank you so much. Korede Bamishile has produced the program this morning. Logistics support provided by Adeyinka Gbemigbade, who's the Public Affairs Officer for LASHMA. Thank you for making this happen. And to our social media team, Philip Akinwara, Mobosola Kasali, thank you so much. Our executive producer is Tayo Akonle. Tomorrow, your side mirror will return. But till then, this is Victor Oteri. Take good care of your health and make sure you're plugged in to the Lagos State Health Insurance Scheme. Bye.